1 second. Oh, Jacob, come in.
Hi, Nurse John.
Hi, Jacob. What brings you to my office again today?
My stomach hurts. I don't feel good. I want to go home. Can you call my mommy, please?
Well, let's take a second and check you out. What did you eat for lunch today?
Peanut butter and jelly. I think I had some juice, carrots. That's it.
That sounds like a reasonable lunch. Was your stomach hurting you before you ate?
Yeah, all morning.
I wonder if something else could be the cause. You know, you came in earlier this week with a stomach ache, and last week you came in 3 times for a headache.
Yeah, I don't feel very good, Nurse John. I just want to go home.
Jacob, you know, I think there may be something else bothering you. Is there?
There is. I'm nervous all the time. I can't sleep. And sometimes I wet the bed.
Aw, you poor fella. Come here. It's gonna be okay.
Thanks.
Jacob, tell me, is there someone that's hurting your feelings?
Well, there's this 8th grader. His name's Philip. And he's so mean. He takes these pictures, these mean pictures of me, and puts them up on Instagram. And he posts these comments on Facebook. And just the other day, he put up a picture of me in the locker room without my shirt. And I mean, he's like, why is he wearing a sweater, LOL. And it's like, I mean, I'm a hairy guy, but come on.
That's rough, Jacob. It sounds like Philip's a real bully, huh? You know, I learned that most kids who bully are actually bullied themselves somewhere. Maybe he's having problems at home. Or maybe he can't get a girlfriend, and that's bothering him. Whatever the cause is, I think that one of the best things that you could do is, when you can, try to be Philip's friend. Show him that, first of all, you know, what he's doing doesn't bother you, and always be nice to him. And you never know, you might wind up being able to help him figure out what's really going on.
That sounds cool, but I'm not sure I can do that every day.
Yeah, I understand that. Well, maybe something else you could try is leaving your phone in your locker, since that's where you'll access most of your social media. Or maybe you could just delete the apps if you need to, or just turn off push notifications so you don't get the notifications.
That sounds like a great plan.
Alright. Bye, Jacob.
Bye, John.
As you have just seen in the brief video, Nurse John was able to peel back the layers of a vulnerable, bullied student. He was able to identify the root cause of the recurrent stomach aches and headaches the student was experiencing and how to advocate for that client. My name is Elizabeth, and I'm a registered nurse here to discuss school-based bullying. Those who are targeted by bullies may experience depression and anxiety, changes in sleep and eating habits, and health complaints, all leaving one to feel isolated from their peers. As nurses, we must advocate not only for the victim of the bullying, but for the bully themselves. Bullying can be a sign of other serious antisocial and violent behaviors. According to StopBullying.gov, those who frequently bully their peers are more likely than others to abuse alcohol and other drugs, get into fights, engage in early sexual activity, and be abusive to their romantic partners. We know that nurses must advocate for these troubled students, but the question is how? Our position is to first prevent the violence. Then we must detect and identify it, and intervene as an educator and an advocate. We can start by creating community-based bullying awareness programs and educate the students to help them understand and recognize bullying, encourage them to report the events, and teach them strategies on how to stay safe. Some of these clients may find it difficult to approach a nurse in the school setting due to the fear of repercussions. So therefore, as nurses, we must ensure that we build and maintain a relationship with our patients. We never want them to feel as though they are not going to be safe. As John demonstrated in the video, when a student presents with somatic symptoms that are unexplained, We must do a screening to rule out that bullying and victimization are not a cause. Once we confirm this and identify bullying as a root cause, we need to guide our patients down the path to security and well-being. As nurses, we must be the voice, speaking up for people who have no resources, who have no connections, and who have no ability to navigate through a system. It is our duty to guide these individuals.
Jeffrey Johnson, Stand Up for All Students Act. Cyberbullying, harassment, being picked on for what sexual orientation you go with, your race, your preference in anything. We have this act that helps students, also employees, to help fight back. They don't want to confront their bulliers and let their parents know what that. School psychologists, we have school nurses, we have teachers, we have peer counselors, but some students just don't want to confront their issue. Maybe it will make things even worse. Advancements in health equity in regards to bullying at school has been better food, better choices for students to have. And you ask, what does food have to do with bullying? Well, there's been studies that have shown with healthier food choices, students are more happier, in a better mood, so therefore less bullying will take place.